Greetings, viewers. I'm by name Kiyini Jimedine, the Executive Director of Zidan Benevolence. Now, our organization is based in Uganda, Africa as a continent. We are doing our activities within the rural areas of Uganda, especially Wikwe district, a newly formed district. Now, Zidan Benevolence is an organization with a mission to work towards the elimination of HIV/AIDS stigma and fight against pediatric HIV/AIDS through disease awareness, disease prevention, professional and child education, improving scientific capacity, strengthening healthcare and treatment services for women, children, and families. We are doing this simply because we are trying to empower communities free from ignorance, extreme poverty, and generate an HIV-free society where new infections are halted and people living with HIV or affected by HIV receive quality services and support. We are doing it to rescue the underprivileged. We are operating within rural areas. And we are doing all these activities basing on a theory called the behavior change approach theory. We are doing it voluntarily. Because for me, volunteering for non-profit organization, because at first I was volunteering for non-profit organizations. Since 2007, I was volunteering. And for me, volunteering for non-profit organization is a time-honored tradition. While volunteering, I gain valuable experience and sense of community involvement. And I keep on telling my colleagues I do work with them. At least now for them, they also determined to do the work. Voluntary work is important to our health because it improves the psychological and physical health. Me, I myself, as a volunteer, I reap the benefits of feeling a personal sense of accomplishment while building social networks that in turn support us in times of stress. That's why we are doing this work. And my colleagues, and they believe in me because I've tried also to change their lives. We do this work and hope those in need of a hope using the behavior change approach in these rural areas. The behavior change approach, we use it just to encourage our community members to adopt healthy lifestyle behaviors, to use preventive health services, and to take responsibility for their own health. It's all about teaching them how to monitor their life before being attacked by diseases. For those especially in rural areas, they can monitor their life, but they don't know. So in these rural areas where we are operating, there are no hospitals, there are no schools. And when I talk of hospitals, I include also the health centers, clinics, and pharmacies, schools, daycare, nursery schools, primary schools, secondary and universities. You find a full sub-county when it has only one secondary school. A full district, one university, and some districts have no universities. But for daycare, primary schools, you're going to find a full parish without a primary school and a nursery school, including the daycare. These are the areas where you are not going to find borehole or tap water. It's very difficult to find a home with a car or a motorcycle or a bicycle. So these are the areas where you're going to find 3 to 4 villages when there is no shop, there is no canteen or grocery. You find almost 2 sub-counties or a county, especially now in Buikwe. You find a county without a supermarket. I repeat this, you find a county without a supermarket. So now you can understand the villages or the rural areas where we are operating. You pass or you visit more than 10 homes, but when there is no anyone with a mobile phone. So issues of passing the information on social media, on other medias, doesn't help them. It doesn't. So me and my members, I tried at least to organize those I used to volunteer with, and a few, because others believed in coming up and they needed to be paid. That's what they expected. But at least I tried to train other volunteers so that at least they can understand that when you're doing voluntary work, it's not all about being paid, but it helps to gain more skills, as I explained. So I also have members and I also have my team on the top management, but those also who understand why we are doing this work. So we are trying our level best to use the behavior change approach to help especially those who are positive living and those who are affected by HIV. We are trying to help them so that they can understand how to live a neutralized life. When I talk of a neutralized life, I mean how to live HIV neutral. Not talking about someone whose status. We are all human beings. The habit of isolating the positive living, that's what we are fighting. We are fighting stigma using our behavior change approach. We need them to live a neutralized life, because some homes you find when the positive living are isolated, positive living do not share utensils with the negative living. Why? It is simply because people are ignorant. They think that you can be infected when you shake hands with the positive living. When you hug, they think that you steal. When you share utensils, when you share the same bed. That's why they keep on isolating them. But we keep on at least making them know the modes of transmission of HIV. We also tell them, we do bring in also the link between nutrition and HIV, so that at least these people who are infected or the positive living can understand how to balance their diet, because the medicine they're taking is strong. And if you don't balance your diet, you're going to become ill. So we try to teach them, both of them, so that at least they can live a neutralized life in the field of HIV. They can't access the health centers simply because they are far from them. But we try our level best, at least, to give them the relevant information about HIV using the behavioral change approach. At least any slight change they experience, or any symptom, they need to give us a call, or they need to talk to the people we live in these areas, so that they find out what could be the problem. If it's beyond them, they have to give us a call. If it's beyond us and needs medical attention, we need to forward them to the health centers. You know, for us, when we are to go in an area, at least to do our voluntary counseling and testing, when we are to go in any area to give them the developmental ideas, if it's time for family planning methods, still we first go there and train the community members, those who are willing to work with us as volunteers. We first train, then after training, we go and do the outreach. Why do we do this? We want, after finishing the outreach and leave the area, these people we've trained at least to try to monitor those who are in need of their hope, so that at least even these people, when they need hope, they can reach them. Especially maybe when they want to talk to us. It's not good to go in an area, you do your outreach, and again you leave. When you leave, especially those organizations coming from urban areas, when you leave, these people may need your hope, but they cannot reach you. Remember, they are far, and they're also far. You cannot reach them in time. So it's better at least those you train, try to monitor them. They will be also updating us. We tell them that monitor them, then after monitoring, update us, so that at least we can know what is really taking place, or what's their condition. We are trying to do this to help them. So we teach them the link between nutrition and HIV, simply because we want them at least not to become ill when they are taking their medicine. Because without balancing the diet, you will be weak and you will be ill. The medicine is strong. When you fail to eat food well, it will be a problem. So we try our level best. We try our level best, at least to make them understand the link between nutrition, what to eat and what not to eat. It really helps. It really helps. And when we leave, again, we also try our level best to find out with the health center those who are on medication. Are they coming to collect their medicine? If they are not coming, we try to find out what could be the problem. It doesn't mean that we go and reach them, because like people do not disclose of their status. But we try to reach areas and make awareness, at least so that they can understand that people in the field of HIV are within the area so that we can attract them and come and tell us their problem. If it's transport, for us in our organization, what we do, those who are far away and deep in forest, what we do, at least we try our level best to know their schedule and deliver the medicine to them. Some people still think that HIV is all about witchcraft, that people are bewitched in rural areas. That's what is in their minds. But we are trying our level best to erase that mentality out of them. And some, for them, they think that, we keep on telling them that AIDS does not inevitably lead to death. But for them, they have it in mind that when you have AIDS, or when you're positive living, he or she will die, or you will die. That's what is in their minds. But AIDS does not inevitably lead to death. It doesn't. Especially if you suppress, the cofactors that support the disease. It doesn't. I'm telling you, it doesn't. And for those viewing this video, have it in mind that AIDS does not inevitably lead to death, especially if you suppress the cofactors that support the disease. It doesn't lead to death. It's very important for everyone at least to be updated. But when they are not updated, they'll keep thinking of being bewitched, witchcraft every time. To deliver a message now, we need to band together as a unit every day so that we conquer the strength of the AIDS virus. We need to band together. That's why at least my colleagues, the one I work with, they are ever accompanying and they are ever giving me hope, because they are ever ready. No matter where we're going, they keep on showing me at least positive results, and it has pushed me also. So now with HIV, at least with HIV and our behavior change approach, we are really achieving, because there are some indicators we see. The reactions from the village people, the reaction from the rural people shows that at least they are changing now. Because we tell them, when you're not feeling well, immediately don't wait again to become ill and raise us. Any change in your life, any pain you feel, reach your community volunteers for our organization. If there is a need, they'll also reach us, and we shall be in position to help. But with rural people, sometimes it's all about how to communicate. But we are trying to sort that out. Yes, we haven't also started facilitating the volunteers, but I know with time we shall. Because communication is the best weapon to reach guys. So now, with Buikwe about HIV, at least we've reached a level whereby people can reach the health centers, whereby people can be in position to communicate to us. We can be in position to know what is taking place, what they know, what they don't know.